welcome back to Tavern Take 5. I am Gayla, aka the Awkward Introverted Therapist, taking a sidestep from my day-to-day shorts to bring you this informational video as we roll into May, which is Mental Health Awareness Month. Now, this came to mind after speaking with former co-workers as well as a few clients and coming to the realization not everybody understands the difference when we're talking about professionals within the behavioral health field. Now, mind you, this will not be an in-depth touching on all the expansive qualifications, skill levels, anything like that when we're talking about the professionals, but just to give you a brief idea of the different providers so that you can make an educated decision. So this can help you to make an educated decision when you are looking for a provider for yourself and or a loved one. If you have any questions about anything here or you want to know more, you can go on NAMI's website, NAMI, or Mental Health America. Those are two great resources for additional mental health or behavioral health information. Okay, so let's get right into it. All right, so starting with those providers who don't require a degree, an advanced degree, and that would be peer specialists. So the peer specialists, they are title counselors or can be title counselors, but again, they don't have that advanced degree, so they don't have a master's degree. However, they do receive some training with regards to mental health and or substance abuse or substance use. But a lot of their skill set is based on lived experience, so lived mental health and or substance use conditions. They don't do any clinical work, so that's out of their scope unless they are trained and certified to do so. Otherwise, they are able to provide support for clients, help them to identify, recognize, and take stock and utilize the strengths that they possess, as well as build some goals to help them to succeed in life or be more successful in life when you're talking about their war raged against substance use and or mental health. Along those same lines are the the certified alcohol and drug abuse counselors. So again, they don't necessarily have the master's level degree. However, when you're talking about certified, they receive clinical training with regards to alcohol and drug abuse. So they're able to diagnose and provide individual and group counseling, and that's at a higher level than the peer specialist. From there you have, and these aren't in any particular order, these are just the ones that are in my head and that I have listed to kind of touch on. Another is the pastoral counselors. So pastoral counselors, they can, and it depends again on the level. Pastoral counselors, they do or can receive clinical pastoral education, which allows them to be able to diagnose and provide individual and group counseling. See the theme here? But it's not necessarily the case. So with that, the difference is you may have a faith-based counselor to where they are focusing on your spiritual wellness, and so that's the focus there, versus having that certification where they're actually focusing more on clinical things. So that's the difference there. It's treating the spiritual wellness versus that mental health, that clinical wellness of your mental health. Then we have, before we jump into all the alphabet soup in between there that I just want to sandwich, are the medical professional, the medical doctors or and or nurse. So that would be the psychiatrist and or the psychiatric nurse practitioner. Now these are the medical, and I keep saying medical because they prescribe the medications. Even though some of these, when we're starting to get into it, fall into that medical field when we're talking about the alphabet soup, but just stay focused here. With the psychiatrist and the psychiatric nurse practitioners, while they do have the training and they are able to diagnose, treat mental and emotional illness, they don't, in most cases or in a lot of cases, they don't do the talk therapy part. So you may spend maybe 20-30 minutes with them, and that's to see how you're doing overall, gauge what's going on in life, see how you're doing with the medications that you've been prescribed. Are you having any adverse reactions? Do you need to titrate down? What's going on? So that's their focus for the most part. Then you have the psychologist, so clinical psychologist, and that person could be a PhD or PsyD, doctorate of psychology, or the PhD, doctorate of philosophy. But they are clinically based, and they are, you may see them a lot of times in academia. But that's, however, not necessarily always, because these clinical psychologists, because they're able to treat, diagnose, and all of that you may see them in a practice to where they are just seeing clients. But again, they have that option of being in academia, or not only that, do experiments with regards to mental health, different things like that. Almost forgot that piece. A sidestep to that, and I say a sidestep because this next one doesn't have the doctorate, but they are seen as psychologists, and that's a school psychologist. Now, with the school psychologist, they do have an advanced degree, or they may get a certification, because I think in some states you can be certified and be titled a school psychologist. But for them, they're able to diagnose, again, individual and provide individual and group therapy, but they also work with the school staff to make sure things are efficient and the school system is working well. Again, they may or may not be doctors. It just depends on the state. Now, getting into the alphabet soup that kind of I fall under this umbrella. Not this first one, and that's the LCSW. That's the Licensed Clinical Social Worker. Now, you may have heard of MSW and all that. I'm not going to break that down. You can look that up if you want to. But for licensed clinical social workers, they have the master's degree in social work. And they're trained to make diagnoses, provide individual and group counseling, but they also are able to provide case management. That's the thing with the social work realm. They have such a wide scope of things that you may see them in different venues, avenues, hospital setting, agencies, and all of that, because a lot of their work is sometimes, not always, community-based. So case management, helping somebody who's in the hospital get housing, get the services they need, all of those types of things. But again, they can also, if they so choose, and that's their lane that they focus, is do individual one-on-one therapy, group, or even family or couples. Is based on their scope of practice. Then you have me, the LPC, the Licensed Professional Counselor. We have that master's degree, and we're able to diagnose, provide individual and group counseling. But again, it's based on our focus. If I wanted to do family or couples counseling, then that would be something like maybe I would take a course or a certification class just to get some more of that training, but also find somebody that I can consult with as I build those skills, because I don't want to just get the training and then say, oh, okay, well, I'm all good. No, I want to be able to consult and get some insight as I build that muscle to be able to execute to the best of my ability for my clients. Then you have mental health counselors, again, that same training. And then I cannot forget my LMFTs, and that's the licensed marital and family therapists. Their title says it all. So they have that specialized education when it comes to marital and family therapy. Now, is that their only focus? They absolutely can do individual and group, but they have that specialized training. And so just remember all of these different levels when you're talking about when I say they've had the certification, so they've gotten that secondary education at a minimum master's level, so they're able to do therapy. But what you don't want to do is just grab somebody because oh, yep, I went to school, got the training and that. Well, if you haven't been working with families, how can you provide family therapy efficiently and adequately that will meet your client's needs? So do your homework, ask questions, and make the best choice for you. I'm Gayla, aka the Awkward Introverted Therapist. Tavern Take 5, out.